Hi, my name is Virginia. I will be doing an assessment on Mr. Serrano's head, neck, and face today. I know in my nursing career it's not an area that I usually assess unless a patient has a particular issue in the area, usually in the mouth. So I just wanted to do that, and just keeping in mind that for smokers, especially a lot of the oral cancers are in these areas. So I just wanted to put that as part of my normal assessment, just keeping that in mind. Okay. So good morning, Mr. Serrano. My name is Virginia. I'll be your nurse today. I'm just going to do a quick inspection of your head, neck, and face, okay?
Yes, ma'am.
Are you having any issues in the area at all?
Seasonal allergies and nasal problems.
Okay. Is that bothering you very much today?
No.
Okay. So as I'm doing that, I'm just taking a quick visual of his face and looking at the color of his skin, color of his mouth, making sure there's no discoloration, making sure everything is midline, there's no facial drooping, and then just checking for any lumps, bruises, any lesions anywhere, and I don't see anything. So I'm just going to take a quick look inside of your mouth, okay?
Yes, ma'am.
I'll be using my light for this. Go ahead and open your mouth for me. I'm just checking for oral mucosa, the color, making sure it's nice, pink, and moist. I don't want to see any white patches or any erythema, anything like that. Also checking the hard palate, looking for any unusual lumps. Go ahead and lift your tongue up for me. Any lumps, any lesions, any open areas, anything like that. I don't have a tongue depressor, but go ahead and swallow for me.
No.
Say ah.
Ah.
Just checking the uvula. Okay. Just checking the uvula, making sure it's coming up and down and it's in the center. It's not deviating to the sides at all. Just checking dentition again, and his tongue. Just making sure everything is nice, pink, moist. There's no cracks, fissures, anything like that. Just going to check in your nares. Go ahead and bring your head back for me. Thank you. I'm just looking for polyps, any discharge, and checking coloration again. I don't see anything unusual. Also checking his sclera, making sure there's no signs of jaundice, checking conjunctiva, making sure there's no unusual discharge and that the area is nice and pink and moist. Okay, very good. Okay, so now I'm just going to palpate, which means I'm going to feel along to check it, okay?
Yes, ma'am.
You let me know if there's any pain. I'm just going to do the frontal sinuses. No tenderness there.
Mm-mm.
Also checking for any periorbital edema or any discoloration. I'm also going to feel along your head, checking for any lumps, any unusual indentations, any masses, any tender areas. Checking around the ears for any unusual areas. Okay. I'm just going to palpate your lymph nodes, the preauricular. Checking for any swollen areas, any tenderness. You let me know if anything hurts, okay?
Yes, ma'am.
Postauricular, submandibular, submental. Going down the cervical chain. Also want to check his carotid. We'll do this one at a time. Okay. Lean back a little bit. Go ahead and swallow for me. I'm watching his trachea. Make sure it's nice and midline. I'm going to feel along here. You tell me if there's any pain or tenderness. No. Okay. And I don't feel anything unusual. Looking for JVD here as well while I'm there, and I don't see anything. I'm just going to take a listen to his carotids for any bruies. Hold your breath for me. Okay, everything looks good. I'm also just going to check these muscles here, your temporal muscles. Go ahead and clench your teeth for me. Any pain or tenderness there?
Mm-mm.
Okay, everything looks good. Looks like you're doing okay. We'll take the gloves off. Thank you, Mr. Serrano.
Thank
Have
you,
a
ma'am.
nice day.